Welcome and thank you for joining us today. I'm really excited to have the opportunity to spend a few minutes with you to educate, inform, and hopefully give you a clear idea of how to get some relief from the discomfort or pain that you're experiencing. Right off the bat, I need to remind you that this is a pre-recorded webcast. I will be speaking in general terms, so if you are in pain or experiencing any of the symptoms that we discuss and have not done so already, please consult with your primary care physician or schedule an appointment in my office. So let's begin. Again, thank you for taking the time to learn about a very common spinal disorder, lumbar disc herniations. Today we're going to talk about what they are, why they happen, and some of the typical ways that we treat them. Hello, nice to meet you. My name is Greg Elders, and I'm a fellowship-trained spine surgeon. My practice is located in the North Houston, Woodlands, and Conroe area. Just a little bit about me. I have a special interest in minimally invasive spinal surgery and have been practicing now for about 14 years, but I'm fairly new to this community. So let's take a minute to talk about the prevalence of lumbar disc herniations. It's estimated that around 8 million people in the U.S. alone suffer from lumbar disc herniations. So this is a very common disorder, and you can see a very large number of patients in need of help. In fact, it's one of the most common pathologies or diseases that I treat in my own practice. Let's talk a little bit about the lumbar region of the spine. Your spine is a very complex and organized system that allows you to efficiently perform your daily tasks and routines. It protects the neural or nerve elements that connect your brain to the rest of your body. Therefore, it must be rigid and strong, but also flexible and allow for motion. Your spine accomplishes this by what we call motion segments. A motion segment is composed of two rigid bones or vertebral bodies connected by a flexible disc in the front and two facet joints in the back. This system, when it's working, allows you to bend and rotate without hurting the very sensitive nerves that it protects. In order to maintain balance and posture, the spine and its motion segments curve in a very specific pattern from your head down to your pelvis. Based on these curves, we separate the spine into three distinct regions: the cervical or neck region, the thoracic or chest region, and the lumbar region or lower back. For the purposes of this webcast, we're going to focus on herniations in the lumbar back or lumbar region. The lumbar region of the spine is typically composed of 5 vertebral bodies. It's important to note that the lumbar region gets a lot of wear and tear because it transfers most of the weight from the upper body to the lower body. So what is a disc herniation? The discs between the vertebral bodies are made up of 2 distinct parts. The squishy, gelatinous material in the middle of the disc is called the nucleus. The nucleus is enclosed by many fibrous layers of tissue called the annulus. These layers are organized like a radial tire in order to withstand a significant amount of pressure. Together, the annulus and the nucleus create a shock-absorbing structure collectively referred to as the disc. A disc herniation occurs when the normal shape of the disc changes and either bulges or breaks open to allow the disc material to interfere with the structures around it. You can see in these graphics that the nerve structures come very close to the disc. When these discs herniate, they can have very negative effects on the nerves, resulting in debilitating symptoms and significantly impacting the person's quality of life. Disc herniations are typically broken down into one of these different types: protrusion, prolapse, extrusion, and sequestration. Each of these different types represents a stage in the cascade of the disc herniation and can result in different symptoms. The important thing to keep in mind here is that intervention at any stage of the cascade may require a specific targeted technique. This is why there is no one-size-fits-all in treating spinal disorders and diseases. It's important to keep an open dialogue with your care provider to ensure that the treatments and therapies that you receive are right for you. There are many techniques that are being heavily marketed on radio and television for treatment of disc herniations. Most of these techniques aren't necessarily unique to those practices and might not be the proper technique for treating your particular problem. It's important that you see a spinal specialist like myself to get an honest assessment as to what different treatment options might serve your own needs better. So what can cause a herniated disc? Most people think that disc herniations result from a traumatic event like a fall. In fact, disc herniations usually occur as a result of the aging process and the repetitive movements that we perform in our daily lives. Pain caused by a lumbar disc herniation can seem to occur suddenly, but it is usually a result of a gradual process. The spinal discs in children have a high water content, which helps the discs stay flexible as they act as cushions between the vertebrae. Over time, as part of the normal aging process, the discs begin to dry out. This leaves the disc's tough inner ring more brittle and vulnerable to cracking and tearing from relatively mild movements, such as picking up a bag of groceries, or twisting the lower back while swinging a golf club, or simply just getting into the car. A less common cause of lumbar herniated discs is a traumatic injury such as a fall or a car accident. An injury can put so much pressure on the disc in the lower back that it herniates. I commonly see patients with herniated discs that experience one or more of these symptoms. The leg pain is typically worse than the low back pain. If the pain radiates along the path of the large sciatic nerve in the back of the leg, that is oftentimes a symptom that suggests a disc herniation. Nerve pain in the leg, with the pain being described as searing, sharp, electric, radiating, or piercing pain, is oftentimes the complaint. Numbness or a pins and needles feeling, weakness, and or tingling may be experienced in the leg, foot, and or toes. Finally, difficulty lifting the foot when walking or standing on the ball of the foot might be symptoms of a disc herniation. It's important to note that pain, numbness, or tingling in the low back, buttock, front or back of the thigh, the calf, foot, and or toes typically affects just one side of the body, although it can affect both sides if the disc herniation is quite large. Risk factors for lumbar disc herniations include age, the most common risk factor being between the ages of 35 and 50. The condition rarely causes symptoms after the age 80, in fact. Gender, men have roughly twice the risk for lumbar disc herniation as compared to women. And physically demanding work, so jobs that require heavy lifting and other physical labor, have been linked to a greater risk of developing a lumbar disc herniation. Pulling, pushing, and twisting actions can add to the risk if they're done repeatedly. Many patients have anxiety about spinal disorders and treatments. At Northwood, we understand that you have a lot of questions and concerns. We make every effort to ensure that you are equipped with all the information that you need to make the best decisions about your course of treatment. When you make an appointment to see us, we start with a physical examination. The physical examination gives us a lot of important information that may not be readily apparent from any images or studies, and typically begins with getting to know you and asking questions. Questions about when and how the pain started are typical, particularly if there was any type of traumatic injury. Other questions may focus on the type of pain. For example, the patient may be asked to describe the pain, including its location, and which activities or positions make it better or worse. Other medical conditions that could be a factor, for example, osteoporosis increases the risk of a fracture. Home and work life, So having a physically demanding job or regularly performing repairs or other strenuous work at home can put pressure on the lumbar disc. Previous medical history will probably be inquired about, including previous treatments or other injuries. And then a family medical history. Lumbar disc herniations are more likely if a family member has the condition. Any experience with depression or anxiety should also be part of the discussion, since this information may be helpful in planning treatment. After performing a detailed interview, we will typically perform a thorough physical examination. The physical examination is crucial to the diagnosis and usually includes observation of the patient bending or stretching. These assessments are also typical: a neurological check to determine whether there is a neurological problem. The doctor will typically look for signs of loss of sensation, such as numbness and weakness in the leg and foot. The patient may be asked to walk normally and on his or her tippy toes to check for a condition called drop foot, in which the muscles used to flex the ankles and toes are weakened. Muscle strength and reflexes in other areas are also likely to be checked. Reflexes may be slower than normal or non-existent. The patient may be asked to lean forward and back and bend from side to side to check for a range of motion. One common stretch to test for a herniated disc is a straight leg raise. For this test, the patient lies down flat on the back and the doctor gently raises the affected leg until pain is felt. If the pain occurs when the leg is raised at a 30 to 70 degree angle, it is considered a sign of lumbar disc herniation. If raising the unaffected leg hurts the affected leg, it also indicates that a nerve root is impinged or irritated. Variations on these stretches include performing the test from a seated position or while the legs are crossed. Some of the medical literature has found that the straight leg raise test is not as helpful for indicating lumbar disc herniations in people older than the age of 60. An increase in pulse or blood pressure when checking the vital signs can be an indication of pain, and an elevated temperature may be a sign of infection. The doctor will observe whether the patient appears to be walking slowly due to the pain or with an abnormal gait. There are certain characteristic gait abnormalities that commonly occur with nerve compression syndromes. If there is inflammation in the lumbar spine, the skin may appear abnormal or sensitive to touch. If we see no signs of a serious problem, the pain is not severe, and there has been no traumatic injury, imaging tests may not be necessary at this point. Some doctors prefer to have the patient wait to see whether the symptoms go away within 6 weeks, as this often results in improvement in many people. A diagnostic test may be ordered to confirm the disc problem and or to gain additional information such as the location of a herniated disc and the impinged upon nerve roots. Diagnostic tests may include computerized tomography or CT scans, which consists of an X-ray taken of the body with a computer reformatting the image into cross-sections of the spine. Sometimes a myelogram is performed during a CT scan, in which radiographic dye is injected into the area to provide more detail on the spinal structures. Magnetic resonance imaging, or MRI, provides a sensitive and accurate assessment of the spinal nerves and anatomy, including disc alignment, height, hydration, and configuration. A discogram may be recommended to confirm that a disc is painful if surgical treatment is considered. In this test, radiographic dye is injected into the disc to recreate the disc pain from the dye's added pressure. When examining the lumbar spine, the physician will look for so-called red flags that might suggest other causes of spinal pathology, such as tumor, infection, or instability. If symptoms suggest that one of these conditions is present, then further workup with more immediate imaging would typically be recommended and more emergent treatment. Well, that's all I have for you today concerning lumbar disc herniations. Again, the key takeaway points from today are that disc herniation is a common problem. The symptoms of a disc herniation can be life-altering. And when considering any treatment options for lumbar disc herniation, it's important to consult with a qualified spinal specialist such as myself. I'll be putting together another webinar on various treatment options, including some of the minimally invasive approaches for addressing lumbar disc herniations in the event that surgery becomes necessary. However, one added takeaway point to add is that many lumbar disc herniations can be addressed through non-surgical means, and we'll be talking about those treatment options as well with the upcoming webinar. So stay tuned for that. If you'd like any more information or to schedule an appointment with me in my office, you can call my office at 832-403-3116 or give us an email at info@northwoodorthospine.com. That's info@northwoodorthospine.com. Thanks for joining us today.